And I next invite Dr. SUNEETA DUBEY. She's going to take you through a difficult process of implementation. She has done for our hospital, she has done for many hospitals, and she is right now medical superintendent at Shroff Charity Eye Hospital, Daryaganj. Madam is also heading glaucoma unit there since I was a fellow. And she's a very good teacher, very humble human being, and always approachable. That's a good thing. So I really like people whom you can approach in case there's a problem. There are many people who are not approachable at all. So Madam is one. If you really need help, you also can approach her. Thank you. So Madam is going to talk about how we can have this knowledge and broadly the steps how we can implement in the hospital.
Okay, I would like to thank Gagan for giving me this opportunity to be in this IC, and I am going to deal with how to implement NABA standards and prepare for assessment. So I myself is not an assessor, but we had got accreditation in 2011. We were the first ones. So every 1.5 years we undergo the process of assessment and reassessment. So we have a fairly good knowledge about how to go about it. And if you have any problem, you can interrupt me in between. So here, this has already been covered. And NABH certification, as you were asking, that whether to go for entry-level accreditation. So yes, because it is easily achievable. If you have not yet gone for any kind of certification or accreditation, then this is a very easy thing to achieve, because it is cost effective also, and it is just 1/4 of the full accreditation standards. And Dr. Gagan has already talked about if you are more than 50 beds and more than 2 specialties, then also you can get the certification. But if you want accreditation, then you have to go in for HCO. SHCO if you are less than 50 beds and less than 2 subspecialties. So our hospital, Shroff Charities, ENT and eye, and less than 50 beds, so we have got SHCO. We can't apply for eye care accreditation. So differences, as you were asking, why it is easy, because some of the criteria, especially related to OT, the standards are less in entry level, and relaxation in OT criteria. As you were saying, in this particular, in entry level, you do not have to have AHU or HEPA filters. You can just do away with split ACs. So window ACs are not allowed, but split ACs are allowed. And then manpower requirement also, the nurse bed ratio and all are not that stringent. And the nurses requirement is less. You do not have to show the calibration. And indicators also, you can choose your own indicators and present. However, in full accreditation, the OT criteria is stringent, and then indicators also, they have a list of indicators. And of course, the fees is also different. So I think that is again a criteria if you just want to first go in for the lesser fee structure and prepare yourself well, go in for this accreditation, and you will be entitled for empanelment in CGSH, ECHS, etc. So once you have started, selected the standards, it's a step-by-step process. So because you cannot just achieve it, because it is difficult process. So you have to first understand the standards, all the 10 chapters. You have to understand. You have to have a team. I'm going to go in detail about all these things. So you have to purchase a guidebook or download it, and I'll just make you understand little bit about what these chapters are all about. The patient-centered chapters. So assess, assessment, and continuity of care. So basically, the intent of the chapter is that your care should be multidisciplinary in nature, provided by the competent staff, and encourages continuity of care. I think the last session they were talking about continuity of care. And you have to define everything. What is the scope of your services? And you have to not only define, but display it also. So I think that is there are, in asterisks, there are some objective elements which are marked, which means that you have to document it properly, and some of them have to be displayed. And then you have to have good processes for, processes for registration, discharge. You have to have standardization in your labs, diagnostics. So this is the intent of this particular chapter, which is a very big chapter. Then care of patient is another very big chapter. And the intent of this chapter is that you provide uniform and safe care to all patients in different settings. Suppose if you have a private setup and a community or a free setup, your standards of care should not differ, because assessors always ask, if you have, doing an applanation tonometry in your private setup and doing an NCT, or, not doing an applanation tonometer in your community or the free wing, that is not acceptable. So I think you have to have a same set of care or quality of care in both the setups. And then you have to have standardized processes for all your procedures, and like emergency procedures, your pediatric department, your anesthesia. You have to have a standardized plan of care for anesthesia, for sedation, for various processes. Management of medications, this is the third chapter, and we often neglect it because we are in an eye hospital and we do not use, too many medications. So this is a neglected chapter. However, you have to have a documented procedure for purchase, storage, and prescription and dispensation of medication. He has already talked about LASA and high-risk medications, and you need to report and analyze your medication errors. That includes adverse drug reactions, adverse drug events, even adverse anesthesia events, because being eye hospital, you tend not to document these errors. Then patient rights and education. Patient rights, patients should be aware of their rights, and this is the question and by the assessor always. And there is interview of certain patients. If the patients are there in the hospital, both in OPD and operation theater, this is one of the important activity that the assessor is going to ask patients, whether they were told about their disease, who is the doctor who is taking care, what is the prognosis, whether you were aware of the charges of the hospital, so all these points will be asked by the assessor to the patient. So I think you need to inform, you need to make the patient partner in their own care. So this aspect is very important. Hospital infection control is a very big chapter, and you need to have a comprehensive program for the, or a manual wherein everything is documented, and you need to have a infection control nurse. You can designate anyone, and there are 3 days courses or 5 days or 7 days courses. They can undergo, even if somebody is not trained, they can undergo the training and get trained. And then you need to document high risk areas and how you're taking care of the sterilization, disinfection, what are the measures to prevent infections, and how you are going to investigate in terms of an outbreak or infection. Then, so these were the clinical chapters. Now coming to the non-clinical chapters. So continuous quality improvement, because NFBH is a journey. It is not a one-time thing. So you have to have processes in place which will take care of the continuous quality improvement. So you have to have a documented CQI program in your hospital, and safety program. I am going to discuss about indicators and audits. And then the management responsibility is very important, because after all they are the leaders. So you have to have a proper organogram and a vision, mission, and quality policy of the hospital. In facility management, you have to have a good plan for prevention and preventive and maintenance plan for the equipment, and site layout, floor plans, fire escape routes. I think all these things are very important, and they are going to check. HR again is a very big chapter, and these are the things which need to be included in the HR manual: the training records, appraisal, grievances, credentialing, privileging, and development of the employees. And last but not the least is the information management system. So you need to have in detail about how you are going to handle your medical records, and how is your IT system. So once you understand all these chapters, what all has to be done, and this you can do only by reading the guidebook in detail. So then you have to find the gap of your actual performance versus the desired performance, where you have to reach. And you should not rush through the process of gap assessment. When we did for our hospital, we did it, at least we devoted 1 week at least to find the gap, because we had to go through all the departments, clinical as well as non-clinical, right from the registration to the inpatient to, the operation theater, discharge process, and then HR, and all non-clinical aspects, facility, infrastructure. So you have to do it, and then there is a self-assessment toolkit which is available. And this is just one example which I would like to give. Suppose this is the first chapter, assess, assessment and continuity of care. So the first objective element is, standard is, the organization defines and displays the services that it provides. So what does it mean? That means the services which you are providing should be clearly defined. Suppose if I am just doing cataract and anterior segment, I am not doing retina or anything else, oculoplasty, then it should be defined. Not only defined, it has to be displayed at the prominent place, and that will be seen. So you have to display your scope of services at your main gate or door. And staff is oriented, because they can ask anyone, any staff, whether he or she is aware of the services in the hospital or not service. So I think this is one of the example. And
even the services are provided by the visiting surgeons.
yeah, that is there. If you have visiting surgeons, then you have to mention what all you have been provided. And then initial, suppose patient cared by the organization undergo an initial. So what do you mean by initial assessment? In most of the eye care organizations, we assess the patient very fast, within 1 hour or 1.5 hours, as opposed to the multi-speciality hospital where they may take a few hours, up to 24 hours. So in HCO standards it is written 24 hours, but in eye care standards you can define your own time, that we are going to assess within 2 hours, and optometrist is going to assess the patient first, or nurse is going to assess. So you have to define. So this way, this is a self-assessment tool for all the objective elements. You need to document whether you have documented, implemented, and what is the evidence. You have to show the evidence also, because whenever you are going to send your compliance report, you have to show the evidence. They are not just going to agree that you have implemented. Where is the evidence? And then you can score. So this is a self-assessment toolkit. So you score yourself, where do you stand? Out of 10, how much you got? Okay, so you may be having gap when you're thinking of applying or going in for accreditation. You may be lacking in terms of having all the licenses, MOUs, medical records in terms of completeness of records, retention policy, OT records. You may not be maintaining records for culture reports, temperature records, humidity, or in autoclave recall process, indicators, and how you are going to refer. As if we do not have all the specialities, we should be having a process how to refer the patient. In infrastructure, you have to have a complete fire safety thing in place. You should have equipment. And you need to do mock drills in between. Okay, so training is a very important aspect, because assessor is going to check the training records, and you have to give your staff members training for BLS, basic life support training, fire safety training. They should know how to use a fire extinguisher, what to do if there is a fire, if the fire breaks out. Then SOP, whatever standard operating procedures you have to give training to your staff. Your HIC practices, hospital infection control practices, how you are going to monitor indicators and all, and common hospital policies like hand hygiene policy. It has become all the more important during COVID times. Biomedical waste management, and needle stick injury. Everyone should know how to do this. So NABH is all about documentation, implementation, and evidences. So you just can't work on your gut feeling. You have to have proper implementation and proper evidences that you have implemented that. And as I said, since all of us are very busy, all the doctors are very busy, if you can dedicate one person, it can be optometrist also, it can be nurse also, If you are a very small hospital, say, you know, just one, the clinic or a very small hospital, then you need not have so many committees. You can have just one core committee who is taking care of everything. And it is better that you have an optom and a nurse part of that committee. So these are the 4 pillars of accreditation: documentation, HIC, safety, and CQI. I have already talked about the SOPs and all, statutory requirements, licenses, and documentation. You need to have all these things, and in the guidebook you will understand what is a standard operating procedure, what are work instructions, what are manuals. So I think you will have to go through it. And common standard, you should have common standards. So you have to document the plan of care. Suppose if the patient is, I can take 5 minutes more?
5 minutes.
Okay. So plan of care, suppose the patient is having, glaucoma and cataract both, and you just want to do a cataract surgery. You have to document that patient right now, I have planned for cataract surgery. The patient will be, the glaucoma surgery will be done later, or patient has been advised to use medication for the time. So the plan of care has to be documented properly. Although I don't think that much of detail is checked, but I think for your own, care, if you make your care, a very standardized care, then I think you have to do. Then safety management or safety protocols are very important. Report medication errors, ADRs, near misses, sentinel events. In our case, sentinel events, that means can harm the patient permanently also. So in our scenario, these are the sentinel events: endophthalmitis, surgical site infections, number of surgeries in which wrong IOLs were implanted, although it is very, very rare, but still number of surgeries where wrong eye got operated. So each of this investigation should trigger or each of these events should trigger an investigation. So just say you have to do and find out the cause, why this endophthalmitis has happened, whether there was something wrong in the operation theater or wrong in the viscoelastics or consumables, whether it was patient factor, uncontrolled diabetes, or surgeon factor. So I think that way you can just analyze the cause. And surgical, Dr. Gagan has already talked about this checklist which you have to apply before incision, before surgery, and before the patient leaves the operation theater. And these are the indicators which you need to monitor, and they are measured over a period of time to achieve improvement. So structural processes and outcome indicators. So structure indicators, you can, it indicates the availability of resources like equipment, infrastructure. And then process indicators like waiting time, time taken for initial assessment, hand hygiene, compliance. And then we measure a lot of outcome indicators like patient satisfaction, surgical outcomes, adverse drug reactions, re-surgery, and resource utilization. So this, you can go through this chapter in the NABH book, wherein they have given a list of clinical regulatory indicators. So, and in that book which Dr. Gagan showed, we have this chapter of quality indicators for an ophthalmic center. So you can just, decide for yourself how many indicators you're going to monitor, whether 5 or 10. And in entry-level certification, you just have to monitor 5 indicators and send them across. And then audits. Finally, the audits. Audits basically is, it is to achieve improvement in documentation, and they are the integral part. So what we are interested, all 4 types of audits have to be done. But initially for certification, you have to do internal audit, which is the audits of the systems and processes. And medical record audit, which emphasizes timeliness, legibility, completeness of case records. And medical audit, this is a peer review of clinical care of patients provided by the clinician. And as you understand the parameters more and more, then you can go in for clinical audit. Although 1 or 2 clinical audits are essential for accreditation. For entry level, I think clinical audit is not important. So medical audit, you have to see whether all the examination points, whether your history, your documentation of management plan, your diagnosis, everything is done appropriately. And if not done appropriately, then you can score yourself and try to improve over a period of time. And this is the internal audit to check compliance with the processes. So finally, what the assessor will check: facility round report, committee documents, clinical audit reports, statutory and regulatory compliances, HIC surveillance activities, personal files, that should include registration, appraisal, grievances, antecedent verification, training records. And these are the CQI, which I just talked about. So I think this all you need to keep ready. Okay, so whosoever is the head of the institute, even if you do not have time, you have to take keen interest, because without the involvement of leadership, this accreditation process will not be possible. And then patient safety should be your diktat, and encourage incident reporting without penalizing. People should not be scared that if they report incident or any untoward event, then they will be penalized. That should not be there. Measure and monitor quality, as we discussed, with indicators and audits, and develop an information system. Continuous training is very, very important. So this is a very lengthy process, but you have to